In this video, I'm going to demonstrate how to add a patient. There's a couple prerequisites first. So in order to add a patient, you need to have an attending physician or their referring physician. You can always use a medical director who will be a user, but if it's a community physician you want to track, then we should add them in. So that's under organization settings and community physicians. And I'm going to go ahead and add one. And it's looking up physicians in your location, in your state. So I'm just going to hope I find someone. Okay, there we go. Dr. Franks. So let's add him in. The second thing you need to add is insurance. You don't have to, but it's useful to have insurance if you're going to do billing and want to track it in the system as well. So let's go ahead and add Medicare, since most people will be taking care of Medicare patients. And the type would be fee for service typically. If you work with Medicare Advantage plans, then you would put in the name of that medical group and then put in, you can use HMO as a choice. That's really all you need, is just to put in the name and pick the insurance type, and then we'll save it. Okay, now to create a patient. So typically you get a referral and you want to add the patient into the system. So that's the first step. After the patient's been added to the system, the next step would be to actually do the admission process, but that's the second step. We're just doing the first step of adding the patient. So from anywhere on your screen in the system on the bottom, there's a plus sign, and that's where you'll find new actions. So we're going to go to add patient. And here you have your attending physician you can choose. It'll by default use the medical director or one of the community physicians like Dr. Franks. And then here in demographics, you can enter in the names. So I'm just, again, making up fictitious names here. If they have a nickname, you can add that as well. Or leave it blank. So let me just go ahead and fill this out. And you don't have to fill out these parts. That's optional. Residence is where you'll put the address. And I'm just making this up. Hopefully it's no one you know. And your pop-up for your state. I'm using an iPad to do this demonstration. But it's basically the same on other devices. Even a phone, you can do this. And of course, you can add email, other information. Responsible party will simply be, it's optional as well, but it can be a family member that wants to be contacted or the power of attorney. You also have the opportunity to add the insurance if you know it. Sometimes when you get the first referral, they don't have that information, so you might leave it blank. But if you do have the insurance, you would select the insurance and then pick the name. We've only added Medicare. And if you have other information, you can add that as well. And then finally, last step is hospice details. So if they're going to be on your hospice service, anticipate that, you'd select that. Sometimes you get a traveling patient, or if you have a palliative care program, you can designate that category. These you may be unsure of, you can leave it blank or just pick one and then change it later. And that's it, save. And now I've added that patient. You can also get to that screen through this Welcome to Digital Physician. So here it discuss the tasks that are required, and we just worked on adding a patient here. And you can click on this button to get to that add patient screen that we just went through. And also organization settings, where you can get to the community physicians and scroll down insurance list. And then quickly, to find your patient that you just added, if you go to the magnifying glass here and get the search input field, you can type in their name, first name or last name, date of birth, phone number, ID number if you know it. So that was Lewis. So I just type in Lou, it'll match it there. And then you tap on it and it'll pull up his chart. And there it is.